Hey there, I'm Jen, and today we're going to talk about what causes depression. I'm an actual physician, but let's get rid of this filthy white coat and everything that it represents. The elitism and inequality and everything else that I hate about medicine. Also, did you know white coats carry germs? Let's go ahead and burn this. Much better. Yes. I am a little bit different than other doctors, and that is, and you can check my license number in the description below and everything, but we're going to talk real quietly because we're going to have our quiet, secret discussion. As you know, if you've been here before, I suffer from severe depression, lots of mental illness. I am crazy. Crazy is not a medical diagnosis, but and so one of the big problems that I have had with other physicians and is just the judgment and judgmentalism. And I know a lot of you have felt it both from mental health professionals and physicians. And it sucks because those are the people who have the information you need to get better. But you feel like you can't get it without being judged and stuff like that. I don't know if have you ever had that experience? No, your life is perfect and everything goes well in every way. So, I know you saw ASMR in the title. I'm super tired. I had these other things I was going to do, but we're going to start answering the questions you've had. I'm going to try to share the knowledge that I have, and we're going to listen to a little bit of tapping and so forth while we do it. Does that sound good? I thought so. Let me just brush this hair out of your face real quick. Because you have some, and then here on this side too, just a little bit of hair that needs to be brushed out here. There, I think that's good. And my appointment calendar and everything is all set up here. I know you are not booked for today, but it's cool. It's totally cool. You can come hang out with me. So, I hope that this works for you. So good. Good little scratching sounds, you know. Just the good stuff. I know the leather jacket's a little bit noisy. I might take it off later. I don't know what happened to my other jacket. I guess it doesn't matter. So, what causes depression? I promised that we would talk about it, and we will talk about it. Here's the thing. People will tell you a lot of different things. When I was very sick, had a family member tell me some absolute nonsense about depression being caused by certain thoughts and belief systems. And of course you have that. There are people who believe all kinds of things when it comes to belief systems and so forth. But there is a little chart that I would like to show you. I'm going to need you, this is an interactive video, right? So we need to go to the description and pick the handout that I have saved there for you. It's a special handout that I collected. There was a psychologist I worked with when I worked with this particular military hospital, and he just had this great handout that I wanted to use. And so, you know, I took it. And in the front of it, you'll see this multifactorial approach to combating depression. So what is depression? When I'm talking about depression, I'm not talking about being sad, right? There are things like extreme grief, or things like, you know, for example, you're having trouble, you had a horrible life situation happen, and now you're sad, and you've been sad for months afterwards, right? You lost the love of your life, or something like that. That is called an adjustment disorder, according to the DSM. The DSM-5 is the diagnostic manual that we use to determine what is wrong and what treatments we should employ, basically. The DSM-5 is based on definitions, not studies. So it is based on a group of mental health professionals getting together and deciding this is what we're going to call this disorder that has these symptoms, because these symptoms tend to go together, and we've found that they work being treated together, right? That's kind of how it works. Obviously, it's basically a book of definitions. It's like a dictionary for what to call certain groups of disorders. So, for example, what we call antisocial personality disorder, lay people or like forensic psychologists will call like being a psychopath. It's definitions. It's like we have put together a list of, I'm a generalist, by the way, so when I say we, I mean they. I mean the psychiatrists and psychologists. I'm a generalist who just happens to have a ton of experience with mental health because of a little bit extra training, because of my own life and experience as a patient, and because of my work in the military as a sexual assault medical forensic examiner, and the journey leading up to that decision to take that post for a year. So the basically they right is what I mean. I mean they make that decision. They make that decision. I hope you like it. I like these. They're done right. And they're not too noisy. Right, this is supposed to be educational, so let's not forget that. So, when the reason I was talking about the DSM-5 and why we have these like conglomerates of diagnoses, right? So, for example, for antisocial social personality disorder, we've been like, these are the things that we are going to call that. And that helps us, having those definitions helps decide what to treat, because you don't treat PTSD the same way you treat depression, the same way you would treat a personality disorder. Like there are slightly, that's where the studies come in, is we study which techniques have been best in what situations, right? So when I mean depression, I mean major depressive disorder, which is when you have your mood has been down for more than half the time of the past 2 months, right? And it becomes functionally impairing. You begin to lose your interest in doing things. You begin to have unusual feelings of guilt for no reason. You begin to have what's called anergy, which is where you don't have any energy. You begin to be very slow to the point that people can see it. You begin to lose like cognitive function, even to where you can't think or concentrate the same way, right? I'm talking about a fundamental change in your brain chemistry, and that's what I define, that is what we define in the DSM-5 as depression. So what causes that? I mean, that is a huge question, right? It happens when something has changed the alignment of that brain chemistry. And in some ways, and I'm sorry I'm rubbing my eye, but that's because I'm not touching you, also because I'm super tired. It's 7 a.m. and I haven't slept since 7 a.m. yesterday. So I am kind of on a weird situation. Wait, that's not true. I don't know how long I've been awake. So, again, things are different. How long have you been awake? Well, I hope you get to sleep a little bit after this. So something in depression, something has fundamentally changed your brain chemistry and even the structure. What do I mean by the structure? So, your neurons carry the information and thoughts that you have. And when you have certain neuronal connections, those connections are particular thoughts and memories. That's how information is stored, by the actual tangles and connections between your neurons, the axons and dendrites, right? So, for example, if you think a thought frequently and you use a thought very often, that connection becomes very, very strong because it's used many, many times. So it becomes very, very strong. Why? Because neuron connections that are not used release a hormone that says kill me to the brain, actually. And so then those connections die and the neurons make different connections, right? Whereas neurons that have a lot of connections, they release a lot of NMDA, they release a lot of like, hey, we're working here, keep me alive, right? And that's how, the little accessory cells within your brain, not exactly your glial cells, but cells like that help out the neurons, that's kind of where they're working, right? But basically, poison, your brain has its own little poison it uses to kill connections it's not using anymore, right? And all of that is influenced by your neurotransmitters. So dopamine will cause certain signals to go certain ways through certain part of your brain. Serotonin will cause certain signals to go certain ways. And so you have this combination of factors that make up your brain. Dopamine is the reward hormone. Predominantly, it'll be down in cases of depression where you don't have a lot of you no longer care about doing anything. You're no longer interested in doing the things that you used to do. That's more low dopamine because it's the motivating hormone. Whereas on the other hand, things like schizophrenia, there's too much dopamine, right? So you see how you would need a different definition for the different diseases, because you definitely don't want to give someone a medication that's going to give them a ton of dopamine if that's the problem, right? But for depression, for major depressive disorder and related mood disorders, there just is not enough dopamine. Serotonin, considered often the happy hormone, also regulates, in some ways, smooth muscle contraction in the body, specifically blood vessels, other places like that. It's got other roles, but that's the hormone where you kind of feel contented and well-being and kind of safe, right? That kind of happiness. Whereas dopamine is more like I'm going to go get it, like your motivation type hormone. And so some people have just very little serotonin, and that makes you feel very, very sad. And some people have very little dopamine, and that makes them feel like nothing matters and they don't want to do anything anymore. And some people have a combination of both. This is why your physician will usually start, because when we're giving medications for depression, we're giving something that affects the brain chemistry, and so that's dangerous. We'll give the safest medication, which is a medication that affects serotonin. Specifically, we give SSRIs, which are selective serotonin reuptake inhibitors. What they're doing is not directly putting serotonin into your body, because it would be digested and wouldn't work. They're preventing, they're like a little key that plugs into the enzyme that breaks down your serotonin, and they're preventing your serotonin from being broken down so that you naturally have more of it floating around. Your body naturally has to break it down and use those when it's done with it, and use that for other stuff. But in your case, you don't have enough of it. It's getting broken down too soon. We block that, and then over time you tend to have more serotonin. Other people need a medication that helps with dopamine, things like a duloxetine, bupropion, and these are your SNRIs, selective, they're what? Whatever it is you said, it totally distracted me. But they do the same thing, selective norepinephrine reuptake inhibitors. I just said dopamine. What's up? Dopamine, norepinephrine, these are different things. Yes, norepinephrine is your adrenaline. It's actually your noradrenaline. Adrenaline is epinephrine. Those are catecholamines. Those are the same kind of thing that's released when you have a ton of cocaine, or when you're in a really intense fight. Your adrenaline going up, right? That's kind of your power hormone. That's more like an emergency version. Dopamine you want to have going all the time, so you have your motivation and you get this stuff done. Norepinephrine helps to regulate a ton of processes in your body, and you need it on all the time, but for other things like your heart rate, other kinds of things like that. However, when it comes to mood, it also plays a role in like an upper, right? It is an upper. It gives you that energy. That's because it affects how all the cells in your body work for a lot of different things. It affects your glucose systems. It affects your systems for, you know, how your neurons work. It affects, like I said, your heart rate. It's a very busy little hormone. It's not a hormone, sorry. Hormones are actually a different thing. I'm just calling it a hormone, but it is a neurotransmitter. So, you know, norepinephrine has all these roles. And up in the catecholamine chain, that, you know, that regulates all of that, you have both norepinephrine and dopamine, and they tend to SNRIs, most SNRIs or unusual antidepressants that aren't in the SSRI category in some way affect dopamine, is what I'm trying to say. Bupropion, for example, is classified as an SNRI. It's known to affect dopamine as well. That's because of where they work in the chain of how these things are made, how they're prevented, how epinephrine affects your dopamine creation, and everything else like that. So there's a lot going on, is what I'm saying. And adrenaline plays a role and matters, dopamine plays a role and matters, serotonin plays a role and matters. And when we're trying to treat depression, we're trying to do a couple things. One, we're trying to regulate those neurotransmitters so that you have the right balance to promote healing. But the other thing we have to do is we have to fix these connections. When we have connections that are unhealthy, or connections that are, you know, quite literally killing you in your brain. And that's what we do with therapies, with, you know, cognitive rewiring, changing how your brain is coping with how it deals with life. And both of these things are done a lot of different ways. Exercise makes an enormous difference in how your metabolism regulates its neurotransmitters. It's amazing because, like I said, epinephrine, norepinephrine are related to all of these different processes in your body. Well, exercise is basically using your heart and your blood to change what's going on with your neuroepinephrine system and everything else in your brain, how your serotonin is released, how it's all connected, right? Diet makes a big difference. Things like omega-3s is what your brain needs to help fix itself and heal itself. And if you're not getting enough omega-3s, there's some kinds of depression where if you have a severe B6 deficiency, you can have severe, like life-ending depression. That's why sometimes I will check the nails of my patients, because B6, while it is not like as directly related to fingernails and things like that as some of your other vitamins, vitamin B6 does have a role in that. And I'll check and see, maybe do we need to get a vitamin B6 level? Because if you don't have enough vitamin B6, how are you gonna, deal with all these other things that your brain needs? And then these social things, like having a community, having people you can talk to and rely on, affect how you create these. Because all of your systems in your brain are constantly being influenced by what you see, what you hear. Literally, when you hear something, your tympanic membrane vibrates and the little hairs behind it vibrate, and those little hairs cause sodium channels to open up in their roots, and they literally send electrical pulses up and up and up into your brain. And when they do that, when they send that information up into your brain, then little electrocutions are happening, little changes in the different systems that are being put together, right? People say you are what you eat. You also are what you see, what you read, what you have going on around you. That is what forms your brain, literally, physically, via those electrical impulses, electrical shocks, everything else that you're getting to your system. So, what causes depression, right? Understanding a little bit about how we try to fix it and why we have to attack from multiple different angles. Well, a lot of anything can happen. If you have a TBI, a traumatic brain injury, you hit your head, that can literally change rewirings immediately. And people with a severe traumatic brain injury will often have problems years afterwards. They might have not just the headaches, changes in vision, tinnitus, or something else, but they may have depression. Sometimes people have PTSD from the event, but other people will they didn't have a problem with processing the event, but their brain structures literally changed to where they have trouble being happy, right? Things have been jarred out of place, right? So that can cause a depression. A severe trauma like that, or like being constantly in a environment that isn't stimulating, that you're not getting the right neurotransmitters, that can affect and cause your depression. So if you are working in a, if your whole life you're working in a dim and gray, awful place, you never have breaks to have healthy food, you only have crap food all the time, you never have time to have exercise, you're never appreciated, you feel like everybody hates you. There are people who survive in those situations, and you can have good coping skills, and that's awesome. But it is possible for the way your brain was, the way you are born, for some situations where you just have the chronic, low, miserable stress of never sleeping, never eating. We can induce depression in people by depriving them of sleep for a certain period of time. You can actually also induce psychosis. In rats, there was an experiment, you should totally look this up on PubMed, where we were able to induce a complete immune system breakdown so that the rats died of overwhelming infections just by not letting them sleep for 2 weeks. You are a rat. Obviously, it's a little bit different for you, right? But, sleep matters, right? Sleep matters. So if you are chronically in a situation where your brain is starved from the stuff it needs, it's never getting the appropriate stimulation, it's always only getting negative stimulation, that can cause a depression. Now, I'm not giving you license to blame your depression on your work or your boss. Because that would be an adjustment disorder. If it's directly because of your, if you have a new job and it's miserable and it sucks and you have this situation for about 2 months, that's an adjustment disorder. Now you can diagnose MDD after 2 months. In the military, a lot of people prefer to wait until 6 months, not because of the definition of MDD, but because of the definition of adjustment disorder. They want to make sure they've filled out the time of adjustment disorder and it's passed before they put the diagnosis of depression on there. As a rule, if an event happened and then you have 6 months, that's an adjustment disorder, and that can be just as severe. You can die from that as well. But when we're talking about an MDD, it's usually a different and more prolonged change in brain chemistry. And that's something that maybe wasn't caused by it's not caused by just one event. There's something else happening, right? It can be, but it's caused by a change in the brain structure, change in things that have happened as a result of chronic stuff. If it sounds fuzzy, the differentiation I'm making between these two things, that's because it is possible. I have made arguments for somebody being diagnosed with MDD who other people said should be diagnosed with an adjustment disorder, and not vice versa. I always tend to be a little more generous with my diagnoses, but just because I'm trying to get the patient what they need, and sometimes to do that you gotta really push with certain diagnoses, at least in the military, in order to take care of people and make sure they're going to get the attention that they need. But that's not to minimize adjustment disorder. That's not to say that it's not worthwhile if you are having a miserable time and you need help during that time. It just means that I might think differently about medicating an adjustment disorder versus an MDD, and there's different kinds of I might focus more on IPT, interpersonal therapy, for somebody with adjustment disorder, and then some basic CBT. Somebody with MDD, I would go with the CBT, but I would be interested also in pushing for DBT for especially a younger person who has much more severe, who has a severe suicide or self-harm risk, right? So those are things that I'll push. So you see, it kind of matters a little bit insofar as how I'm going to take care of the person. Adjustment disorder, the real thing is trying to focus on, the focus is all going to be on the problem that caused it, right? Their issue with work, their issue with, their loss, grief, that kind of thing. That's what we're going to be focusing on in any kind of interpersonal care. Versus with MDD, they're going to have these bigger, I am worthless, everything sucks. And this is, again, these are not these are not in the diagnosis as like black and white. These are what people feel. People who have MDD meet a certain number of criteria that adjustment disorder people do not meet. It's numbers and time, right? But generally, the people with the MDD, it's not going to be like one thing. They're not going to be trying to get over a thing or cope with a thing. They're trying to cope with life. Like someone with MDD, like life is too much for them. They can't do life. I'm one of these. Adjustment disorder, this situation or issue is too much for them. I don't know if that helps to make the difference. But so when I'm talking about what causes a thing, in the adjustment disorder, the distress is caused by the event. In MDD, the distress is caused by something either over a long period of time or very directly with like a traumatic brain injury, changing the brain structure so that you cannot cope with life. And you'll be surprised at what kind of things can cause that. So for example, we had a case study in medical school with a woman who was with an abusive person who would beat her every day, and her life was very scary. It was very difficult for her to get away from this person because, you know, statistically, people are usually like, everyone's always like, oh, she should leave the domestic abuse person. Statistically, that is when women usually are killed. It's either, so women are more likely to be murdered when they're pregnant, and especially if they refused to have an abortion or something like that, but they're statistically, pregnant women are more likely to be killed. And then the other group of women that are more likely to be murdered is women who are trying to leave an abusive situation. Like when they try to leave, that's when the abuser goes, well, if I can't have you, no one can have you, and then they kill them. So it's not as easy, right, as people want to try to make it sound. So you'll bear with me, right? Bear with me. I'm giving you good information. I'm just sleepy about it. I hope these are good sounds. I kind of want to put the earbuds in my ears so I can have the good sounds too. I might do that for the next video. Here's the deal. Are you listening? Here's the deal. So, oh, that's true. You're right. So this case study, right? This woman was being abused, and she eventually escaped. It was when she escaped and she was within a good situation that she became depressed. Why? Well, the answer kind of lies a little in the medications that finally worked with her. The SSRIs didn't do anything for her, the things to increase dopamine. But the things to increase norepinephrine did. Now, when you think about that, when she was in the abusive situation, she was constantly getting adrenaline, right? Because having to like fear for your life every day, that'll keep your adrenaline up, right? So her brain got used to this flood of adrenaline that it was constantly having. The abuser is gone. She's now safe. She's with someone who cares about her, and she's happy. But so she has enough serotonin. The SSRI didn't help with that. No one measured her serotonin levels, but this is what you can infer based on what medications didn't work for her. The SSRI didn't help her. Serotonin level changes didn't make a difference, but changing her norepinephrine levels did, right? Giving her the adrenaline back because her brain had started to get used to not having enough adrenaline, or to having so much adrenaline, and so now she doesn't have it anymore. And the brain is like, where's all that adrenaline? I have no purpose. I have nothing to live for. I'm not fighting. I'm not doing anything. I have no survival mode. What's going on? And it just, you know. So in her case, her depression happened because of a fundamental change in her brain that happened after being flooded with norepinephrine over this period of time, right? So what I'm saying is MDD can happen for a lot of different reasons, right? You can have a very gradual change over time. There's also something called PDD, persistent dysthymic disorder, which is a depression. It's an MDD that's lower grade in severity, but lasts much longer, like years and years and years. And it's miserable and takes, you know, forever to treat. It just doesn't get better. And that's a PDD, right? Persistent I haven't seen it diagnosed a lot. I've usually seen people diagnose the MDD, but I think that's just because of the nature of working in the military. Yeah, so something has changed in the brain, and it's going to be different for every person. But, so in your case, I don't know if it's because of over a long period of time, you know, you had a certain amount of trauma and now you're out of the trauma, things changed with your norepinephrine. I don't know if over a very long period of time, things changed with your serotonin processing, right? Because, you know, I don't know if chronic unfulfillment, chronic bad diet, chronic, like, basically is your brain being starved, either as a child or a teenager or now entering the workforce. I don't know if it's because of that, but something has changed in your brain, or if you were hit in the head, right? But some kind of thing has changed in your brain, and that's what causes MDD. And I think we've gone over what causes adjustment disorder too. So we've gone, have I answered your question? I hope so. And I hope you got a little bit of good sounds. And we have the whole playlist to help you, and then the handout that I'm putting down there, that will help you with kind of, now that you kind of understand the many factors that go into your depression, it'll help you figure out what are the many factors you can use to fight it. And I'm linking the playlist, so you should click on that and keep watching and learn other ways to help yourself. The very first video on the playlist, as you know, is the video that talks about, you know, actually the diagnostic criteria for MDD, and then the next videos go to how to help it. So yeah, save that and watch it. And I have other resources in the description as well, including ways to get a therapist, and books that have helped me. So I hope that helps. Definitely, yeah, go there. Go there and get better.
This medical ASMR paid for by patrons. If this helped you, help someone else. There's a list of causes at becominghero.ninja, and if you need more help or you just want some bonus gifts, please check out all the cool links in the description for mental health resources or free science